Are you frustrated and tired dealing with runner's knee pain? Pain that sits around your kneecap and bothers you when you're out on your long runs? Have you tried treatments without any relief and all you want to do is get back to running the miles you want? If so, this video is for you. In this video, I'm going to walk you through the 5 exercises you can do to solve runner's knee pain, and I'll tell you the cause of why it's happening and exactly how you can fix it. Hey everyone, I'm Dr. Kevin Vandy, physical therapist and running specialist that's worked with thousands of runners in dealing with runner's knee. And in this video, I'm going to show you exactly what causes runner's knee and, more importantly, how you can fix it. The first thing is, what is runner's knee? So it's called patellofemoral pain syndrome. And what that means is pain between your kneecap and your thigh bone. Now what happens with running, since running is a single leg sport, is you have to control the position of your pelvis, the position of your thigh, and the position of your foot. Each of those 3 components plays into developing, or the causes that could develop runner's knee. What are they? What are the leading risk factors for runner's knee? Number 1 is internal rotation of your femur, meaning this bone, your thigh bone, rolls inward every time you land when you run. Ideally, your kneecap should point straight over your second toe and your pelvis should be aligned forward. When that doesn't happen and your femur rolls inward, what happens is your femur rolls inward but your patella relatively rolls outward. When that happens, it changes the congruency of the 2 structures and you get increased pressure at different parts of your patella. That increased pressure creates overuse, and that's why you get pain in runner's knee that could be lateral, superior, medial, depending on where your knee is moving. What we have to solve is, why is the thigh rolling inwards? Now, you may have tried taping your knee. Maybe you went to a physio or massage therapist and they tape your kneecap to try to control the position of your knee. Is that successful? It can be. It can reduce pain, but it doesn't treat the root cause because the patella doesn't move on the thigh. In fact, it's the other way around. The thigh moves underneath the patella. So the goal of treating runner's knee is to control what your thigh does, not what the kneecap does. So you might be asking, what controls the thigh? Well, that's your glute muscles, your gluteus maximus and medius, your big butt muscles. Those muscles, when you're on one leg, are directly responsible for the position of your knee, whether it rolls out or in. So the exercises I'll be showing today are how to activate those muscles. And that's one of the important parts here, is can your brain actually access those tissues? And in my lab, we have muscle EMG, which is a technology where we put a sensor on a specific muscle, and we can see in a graph whether that muscle is turned on or turned off. Basically, can your brain get to that muscle? Well, with runners, they struggle with turning on the glute. The part of your brain where your glute sits is a very small area, and so it's hard for you to access it without turning on other things, like your quad, your TFL, your hamstring. So you have to isolate and train that muscle specifically, which is part of the exercises we'll go through today. So rewiring your brain and your body to turn on the glute every time your foot hits the ground will allow you to keep better alignment of your thigh and patella, reducing the loading at that joint. And that's the solve of runner's knee, is controlling your alignment with every step. Another piece that influences runner's knee pain is running biomechanics. One of those being, if you run with a very upright trunk, or in fact you lean back, that increases the pressure and load at your quad and patella, and that can also increase pain associated with runner's knee. If you've been trying to solve runner's knee, there's one piece that you're likely missing that can be a game changer, that can take you from having some residual pain when you're running your long runs to having no pain at all. And that's how we rewire your brain and your butt muscle to work together, literally creating a better pathway of information so you can turn on your glute, you can turn it on fast, and you can use it functionally to stabilize your knee. The exercises I'll be showing you today are going to show you how to do that. The first exercise I'm going to show you is called a kneeling fire hydrant. Now, this exercise uses the glute in 3 different ways. It uses it in abduction, moving your leg out to the side, uses it in extension, getting your leg out behind you, and uses it in external rotation. The 3 key motions you need to make sure that your femur, your thigh bone, doesn't internally rotate or adduct, the 2 leading risk factors for developing runner's knee. So when you do this drill, you want to move in all 3 motions, and here's the key. You want to hold this drill for at least 30 seconds. Now that might be different from what you're used to, but what we're trying to do is overload the brain with stimulus to turn on the glute. By doing so, you have that signal that develops over time, remyelinating that pathway between your brain and your glute, so that your brain, every time you run, can turn it on without thinking about it. If you just do reps, you're really only using the structure for a few seconds. By holding it, that stimulus is going to be so large that your brain has to pay attention to it, and it's going to rewire that pathway. So here's how it looks. You're going to be on all 4s, abdominal muscles nice and tight. You're going to start by kicking your leg into extension, so you turn on your glute here. Then you're going to externally rotate, meaning you're going to turn your knee out to the side, and then you're going to abduct. You're going to push away from the other knee so that you're really feeling it in the glute that is in the air. And you're going to hold that for 30 seconds, really focusing on turning on your glute through an isometric hold. The second exercise we're going to go through is going to work your gluteus medius, the muscle that sits on the outside of your hip and is directly responsible for controlling pelvic drop and controlling whether your thigh moves in, not rotates in, but moves in. That's called your gluteus medius. And we're going to isolate that muscle doing a side-lying hip abduction. So this is what that looks like here. You're going to be on your side, all the way down on the ground. What you're going to do is you're going to make sure your hip is pointing straight up to the sky. Your bottom knee is bent. You need to lock this top leg, so your knee needs to be locked tight. And then from there, what you're going to do, you're going to lift up and then slightly back behind you, and you should feel that right in the outside part of your thigh. Make sure you're taking your butt muscle and you're pressing it forward so you don't roll backward. Again, you're going to hold this 30 seconds. The key to holding is that as you activate this muscle, it sends a signal up to your brain recognizes it, and you develop that pathway. So be sure to hold for 30 seconds. The next exercise we're going to do is called a side plank clamshell. Now, clamshell is a very common exercise. You've probably done it in rehab, but you've probably done it for repetitions. So lift down, lift down. Again, we are going to hold this exercise, but we're going to do it in a side plank so we get both gluteus medius and maximus to be active at the same time. So up on your side, your elbow and knee are going to be in alignment with one another. You're going to press yourself up into a side plank, butt press forward, and you're going to take your top leg and you're going to rotate it up and out so you feel your glute. You're going to feel your left glute, you're going to feel your right glute. Again, you're going to hold and focus on isolating your glutes to do the work. The fourth drill we're going to go through is a runner's lunge. Now, this position is important because we're going to go from a position of shock absorption from upright to down into a landing position like when you run, but it's our first real single leg exercise, and it's going to be loaded in the position of running. So you're going to start here with your legs together, body upright. From there, you're going to drive this leg back diagonal, chest over the knee. The key here, make sure this knee does not roll inward, but instead stays pointing forward. Upright, down. Upright, down. You're going to feel both glutes, but the key for this drill is to keep your stance leg, front leg glute active by pushing out on the band and spreading the floor. As you get good, you can add some speed to mimic running. You want to do about 15 reps, 3 sets of those. The final drill I'm going to show you is called a quick squat drop. The goal here is to get used to shock absorption so that you're loading your glutes and not as much on your knees. And it's going to look like this. You're going to start upright, feet together. Then you're quickly going to drop the key here, spread the floor, spread the band, and be in a hip hinge position. Chest over knees, butt back. Start upright, quick drop. Upright, quick drop. Again, the key, make sure the alignment of your knees is straight and not rotated inward. All right, there you have it, the 5 exercises you can use to correct the root cause of runner's knee pain. If you got value from this video, I'd love if you hit like, subscribe, and hit the bell so you get notifications when my future videos come out. Until next time, guys, train smarter and perform better.